having to listen to, oh, you can hear, okay, so you heard
Yes,
all about
yeah,
the dogs
we
and the
can.
cats and all that, okay, wonderful, what a way to get kicked off. So I'm going to call the meeting to order at 9 o'clock today. Thank you so much, everybody, for joining us. September already, wow, I don't know where the time went, but it was a beautiful summer. So we'll start with introductions as we typically do, where we'll go around the room. I'm going to start with the people on Zoom and I'll call on you. If you're able to say your name, organization, and then, of course, one thing that you're grateful for today. And I'm going to start with Megan. Megan, I see that you have a beautiful friend with you, so I don't know if you would like to kick us off.
I would like to kick us off. Good morning, everyone. Megan Bridges, United Way of Northwest Vermont, and I am joined by...
Hi, nice to meet you all. I'm Zoe. I'm serving as a community engagement coordinator under Megan and as a part of the Vista umbrella.
Ooh.
Welcome.
Welcome.
First
Welcome,
time, right?
Zoe.
I hope you know your alma mater song.
No, we're not going to make her do that.
Oh, interpretive dance then.
Yes.
So now, I'm grateful for Zoe. No doubt, it's amazing that we were able to recruit 3 Vistas here at United Way. We are so grateful to have their fresh brains and energy and to offer this as a learning opportunity. So, and Zoe's grateful for.
Now that it's in my core, I feel like I am also grateful to be here and to be getting to know so many different important community members and stakeholders. Yeah.
Great. Thank you, everybody.
Awesome. Welcome, Zoe. If possible, can I have you put your email address in the chat so we can add you to the listserv? And can I also bother you for your last name for the minutes?
Yeah, of course. It's Quigley.
We'll put it in the chat.
I'll put it.
Okay, thank you. All right, and the next person is Isabel.
Hello, everyone. My name is Isabel Amsfeld. I am also with United Way, the Working Bridges program, filling in for Haley Schreiner, who's usually here, but I support Community College of Vermont students coming to St. Albans tomorrow. So I'm looking forward to learning more about this partnership, and I'm grateful for the sunny day that we get now and just soaking it in.
Awesome, thank you, Isabel. Joanne. Oh, did we-
There. My name is Joanne Crawford. My pronouns are she, her. This is my first time.
Welcome.
I know she doesn't remember her alma mater song.
My organization is Abnaki Health and Heritage. We are a small Vermont nonprofit. Our mission is to improve the health and well-being of Abnaki people, no matter their tribal affiliation or status. And we also, we work with healthcare organizations to provide trainings around working with Abnaki folks. And you can learn more about us by going to our website. And I'm thankful for Erin Creeley for inviting me.
Yay.
Awesome, thank you to Erin for inviting you. And Joanne, can you put your email address in the chat so we can make sure you're on the listserv?
And the website that you were just talking about.
Okay.
Thank you.
Wonderful, thank you so much. Kate.
Hi, about my mom. I'm Kate Bloin. I am the Choices for Care nurse in Franklin and Grand Isle County with Dale, and then I'm the executive director of Hope Grove Recovery, which is starting a recovery house for women here in St. Albans, Vermont.
And what are you grateful for?
Oh, I don't know. I'm grateful for my son this morning. It was very cute. He was like caring about the little boy at preschool that was crying. And it was his second day and he was nervous. So I just loved that he was like helping out another. It was like a delight, really. And I'm grateful he's a good kid, but it was just so cute to see him helping another little guy in the classroom. Thanks.
Oh,
Way to go, Will. Thank you.
yes, exactly.
Jess.
Good morning, everyone. I'm Jess Braff, the Director of Franklin Grand Isle Community Action, a program of CBOEO. And I am grateful for the warm weather. I agree that as we hit September, every single beautiful, sunny, warm day has to be savored.
Awesome, thank you, Jess. Randy?
Good morning, Randy Hamlin, Turning Point of Franklin County. I'm a recovery coach here. Today I'm very grateful that I get to spend time with my grandbabies over the weekend. And that was something new to me this year. I've been blessed. Thank you.
Aw.
Thanks, Randy.
Thanks, Randy. Samantha?
Hi, I'm Samantha Dollinger. I am the domestic violence specialist for DCF, one of them, and I cover this St. Albans district office. And I am thankful that I have a vacation coming up soon.
Awesome, thank you, Samantha. Sarah?
Good morning. I don't think my camera appears to be working. I see a black space where my face is. I'm Sarah. I'm the RN care manager at Savita Health. This morning, I am grateful to have she's not brand new, but she's brand new to Savita, in-person, full-time licensed mental health counselor in the office.
Nice. Awesome. Matthew?
Greetings, my name is Matthew Locor. I use he, them pronouns. First of all, I'm grateful for being able to talk to this meeting. It's been very, very busy for me. I'm actually a member of the Vermont statewide agency correspondent. Basically, I am basically across Vermont. I'm pretty much new from UVM medical insurance and under the umbrella of UVM medical education insurance and medical. That's one. And then I'm from the Vermont League of Cities and Towns. That's two. And number three is I'm part of the Vermont Climate Council, so that's three. Politically, I'm busy across the state of Vermont, making sure that towns across Vermont actually get the access, resources and tools that they need to survive. But I'm grateful to actually finally be here doing these because it's just, for me, it's just, trying to reconnect with y'all. It's just, just an honor. Thank you.
Thank you, Matthew.
Thank you, Matthew.
Katie? DeForge?
Hi, I'm Katie DeForge. I'm the Assistant Director at the Turning Point of Franklin County. And today I am grateful that we have a fantastic boss that allows me to be able to enjoy dropping off my kids for their first days of school, being present for them.
Awesome, thank you, Katie. Marissa?
Hi all, my name is Marissa Darling, she, her pronouns. I work for the state of Vermont in the Office of Economic Opportunity for the new Permanent Supportive Housing Assistance Program. Sorry, lots of steps there. And I'm working with Chittenden and Franklin County. And I'm grateful for, I think, just our community. I know we have a lot of things to work on and build, but really starting to get to know Franklin County and working in Chittenden County for quite some time. I know we have limited resources and not enough staff, but the people who I work with really, really care about what they do, and it's really empowering to see all the time.
Awesome, thank you. And I believe I got everybody on Zoom. I'm gonna pause. If I didn't call on you, please unmute. Okay, so we'll move to the room and I'll start to my left.
Awesome. Hey, good morning everyone. Daniel Roberts, the Director of Community Relations at NCSS. And I'm grateful for football season, getting to have some Sundays spent with friends and family and getting to watch my little nephew play. So it's always fun.
Good morning, I'm Michelle Treya, also from NCSS. I'm from the Parent-Child Center program. I'm the Family Access Coordinator. And I've been very grateful for the amazing produce I've gotten at several farm stands lately.
Yeah.
Hi, Megan Malboff, also from NCSS. I'm the program manager of Outpatient, the Access Team, and Integrated Health. And I'm feeling grateful for sort of the transition into a new season and the reset that offers. Good morning, Amy. Oh, good morning, Amy.
Good morning, Amy.
I am Amy Brewer with the Franklin Grand Isle Tobacco Prevention Coalition and Northwestern Medical Center. Use she, her pronouns. I'm gonna go sappy today. I'm grateful for my husband. Today's our anniversary. And I nearly forgot, and he reminded me, which I'm grateful for. But he's pretty amazing, and it's been a pretty good ride, so I'm super excited.
How many years?
How many
25.
Wow. 25. Congratulations.
Thank you.
I can double you.
What is that? Silver?
I don't know. It's
Yeah, something.
like, remember, let's go out to dinner or something kind of.
Yeah, right. No. My sister-in-law was like, yes, it's our silver anniversary, and we bought ourselves a new fridge that died, you know, so they're like their new silver fridge was there.
Oh.
I was like, that's an expensive one, but.
Yeah, we're not doing that.
Right.
Good morning, folks. I'm Kathleen Shadow, and probably the thing that I am most grateful for today specifically is that it was 1 year ago that I started my job officially at Holy Trinity Episcopal Church in Swanton. So a year ago today, I was in my office for the first time. So that's super exciting for me.
Anniversary.
Awesome.
Oh, amazing.
Hi, I'm Ken Hammond. I'm a Field Service Director with Agency of Human Services. I'm moving from Barry and Hartford districts into Morrisville and St. Albans. So for me, the commute is a lot better. So it's a half hour. Last month, I was thankful for my commute, but I can't do that twice. So I'm thankful for soccer season, high school soccer season. So get to sit and watch. Last night, high school soccer in St. Johnsbury, and it was like sunny and beautiful. And,
Awesome. Mr. John.
John Gordon, Sheldon Food Shelf. I'm thankful for, we just finished a couple of weeks ago, we finished our summer meal distribution there in Sheldon. We distributed in 9 weeks, we distributed 1,765 meal boxes. That's 24,710 meals going out to kids, which was really exciting. And I would be grateful, all you folks that appreciate the sun, I would be grateful for a little bit of rain because I am really getting tired of driving my tractor around on fields that are hard as concrete and bouncing around. And a rainy day means a day off.
There you go. And no dust on the road.
And no dust on the road, yeah.
Good morning, everyone. My name is Mary Peckner, and I'm a substance misuse prevention consultant for the Division of Substance Use Programs, right? At the Department of Health. I almost said ADAP, so some things don't change. And I am incredibly grateful for a good friend who volunteered yesterday to help me pull weeds out of my mother's embankment, about, I don't know, a good 50 yards of weeds, and we tackled it, and it looks beautiful, and I'm so grateful because it was completely overwhelming, so, thank you, Anne.
Nancy.
Yeah.
Of course it was her. I knew it was her. Awesome.
We're gonna keep going.
She's that person that shows up when she knows you're moving and you don't know how to ask for help to move, and so she just shows up and tells you she's helping. She's wonderful. Melinda White, I am the Recovery Coach Supervisor in the Emergency Department and Vermont Blueprint Mat Lead, and Summit co-founder, and I'm gonna touch on that because today I am grateful. I know I wasn't here last month, but the day before, well, a few days before last month's meeting, we had the 4th Annual Substance Use Addiction Summit at the Champlain Valley Expo. We had well over 1,000 people in attendance throughout the duration of the day. We had some amazing speakers. It was a very emotional time. Even said from the podium a few times that we should probably reach out to Kleenex to see if they want to sponsor, because there was a lot of Kleenex used, and we were in and out this year. And super grateful. I'm gonna really be brief. So we did a raffle because we raised money for a family who has lost a loved one to addiction in that year. And a few days before the summit, there was somebody that was lost in this community that many workers, many of us providers have worked with off and on for quite a few years. And the father of her children years ago was in the local sober house, Vermont Foundation of Recovery, when my husband was managing it, and I worked with her a lot. So fast forward for the summit, we were raising money because I know she has children and wanted to raise money for the kids who are growing up a little bit faster than I realized. And when we pulled, I had my sister pull the name of the raffle winner for the 50-50, and it was the father of her children that won it. So of course he donated it back to the family. And I got a card yesterday from her mom because I wasn't able to make the services since I was out of state. And she gave me beautiful pictures of this girl. Her kids wrote a beautiful letter, wildflowers to plant in her honor. And I had just been talking to my sponsor about it earlier yesterday about what a powerful moment that was at the summit, that of all the people that could win the raffle, it was the father of the children with whom the money was going to. And then to get that card 2 hours later, it was just a really powerful reminder of why we do what we do. And even though things don't turn out the way that I know I wish they would have in that family, we pull together more when there are trials and challenges, and we just honor those loved ones that we've lost. So it was just a really beautiful full circle moment yesterday. So I'm grateful for that, grateful for recovery, grateful that this weekend I'm going on a women's 12-step intensive weekend to strengthen my own recovery so I can keep doing what I do. So I'm grateful for all of you to be here. So that was a lot, sorry.
No, you're good.
So we'll move forward with the meeting minute approval. So if we can get a motion for anybody who had a chance to review those, they were sent out in your packet. If anybody has changes, edits, deletions, or wants to motion for approval.
I'll move.
Thank you, John.
I'll second.
Thank you, Super Mary. All in favor?
Aye.
Any opposed? Okay, and the motion passes. So our presenter, I'm excited for Megan to present. I'm excited that we get to partner and work together, and it's been even closer lately. Super enthusiastic about that too. So Megan is going to be sharing with us. NCSS has been doing so much. I mean, the fact that for those of you on Zoom, like the room is all brand new and beautiful. It looks like the walls got pushed out somehow, and I know that's not the reality, but the illusion of a larger room is just beautiful. But also some new programs and updates on some of the upcoming events and all that good stuff. So I will turn it over to you, Megan. You should be all set with the screen share ability. And for people on Zoom, we're just gonna get the PowerPoint pulled up in a second here.
That's the first thing I noticed. It's like, okay.
Wait.
Time is of no consequence today.
Right, here we go.
We don't have a clock.
Okay, so yeah, we can see it on Zoom. And I'm gonna record, so just a heads up to everybody, I'm gonna be recording this for editing later.
Recording in progress.
Okay, perfect.
Hi, so welcome. I'm Megan Malbuff. I already introduced myself, but again, here at NCSS, I run some of our clinical programs, so the outpatient services, that's all of our outpatient therapy for children and adults, our access program, which is a new program that I'll explain to you, and our integrated health. And so, but I've also included a few updates from other programs. September Suicide Awareness Month, so we're very aware of that at NCSS, and I've brought a couple of updates from our emergency services team. And then we also have a Zero Suicide Committee that I co-chair with one of my other staff members, and so I'll bring you some updates from what we're working on there and how that all kind of ties into what we're doing. So just to kind of talk about, here's each thing that we're going to be talking about today. So what we're really trying to do at NCSS, like all of us I think, is try to increase access to services, try to always respond to our community health needs assessment and what our community is asking for, what do they need, and not just sort of blindly decide what's the best thing for our community. We're very aware of suicide. We do a lot of postvention work here, which is responding after a sudden death or suicide, and so we're always trying to increase our suicide prevention programming. And then overall, just a real passion of mine and a lot of people here at NCSS is to increase mental health awareness in general. And we're always working to decrease that stigma around mental health, substance use, anything we can do to reduce the stigma. And a lot of that I tell people over and over is having these conversations, is allowing me to come talk or to watching one of our Joe shows. Like anything where we can really keep the conversation going and make it an open and honest conversation. That's a lot of what we're doing to decrease the stigma. So kind of on that note, as I move through this today, this is not a formal presentation. Please just ask questions as we go, because some of this programming is new and I really would love it if you guys could kind of be ambassadors and help me in the community, explain it to people. So interrupt me and ask questions along the way.
I feel like me and just push all the buttons and hope something.
Yeah,
You hope something happens.
We love it with her cable thing. I don't know how it works. There we go.
Oh, there you go. Okay, yeah, you can go one more. So the Access Center, this is a new building to us. It's on 12 Houghton Street, which is, if you're familiar with St. Albans, it's off Lake Street, kind of set behind the Maple Fields. And so Monday through Friday, we're open 8 to 4, sort of doctor's office hours. We have reception on site, and we have services for both adults and children. So this is the building. Just because people aren't very familiar with it, it's a little bit hidden, but it's actually right in town. And just wanted to show people, like, these are set up. They're counseling offices. It's actually quite a bit more set up than then. But reception area, so our reception staff are all trained the same as our staff at 107 and 130, our building across the road, and they rotate. And so if you go to Houghton Street, you know, it's not really a separate entity. They have the same information, the same phone line, they're trained the same way, and so it's kind of that same welcoming service. It's a much smaller building, but we're trying to kind of mimic that welcoming service and the similar lobby and look and feel. So the program goal essentially is to respond to the community need. So what we're doing here is we're increasing access to outpatient therapy services for adults and children. And that's really important because I think there is some confusion about what we offer here. It really is outpatient therapy, but it's a little bit of a different setup. So we're trying to decrease wait times. That was a lot of feedback we got a couple years ago around COVID time. We did have some wait times here. And with the Access Center being open since December, we have really decreased wait times at NCSS for outpatient therapy. We're reducing barriers. One of the barriers we all know in Vermont is transportation. This isn't a really walkable part of town, even more so than this building. I mean, this building has a proximity to the hospital, but the Access Center is very close to Tim's house, CBOEO, Martha's Kitchen is very close by. So I think, and it has sidewalks, it's truly a walkable area if people are living in town. And then always our goal is prevention. So we know that we are always, we're trying to serve people in our community at NCSS versus sending them to a higher level of care or a hospital. It's always our goal to be able to serve people in their community with people who care about them. And so we're working on prevention as getting people the services they need when they need them. And so that in itself is a prevention effort because we find that sometimes if people have to wait for services, their symptoms can escalate in a way that becomes more severe. So increasing outpatient therapy services. We've had a really high demand in the past few years for outpatient therapy in the Franklin and Grand Isle communities. I honestly think these numbers, if anything, are underreported, but we said that in 2024, 669 adults and 322 children we're seeing in outpatient therapy. And again, what we're hearing from our community needs assessment, from our community partners, we have a new partnership meeting with the pediatric doctors in town. They really want to be able to reach out and have people seen quickly, and so that's really a goal that we're working on to respond to that need. Reducing wait time. So again, the services are just more effective. You know, if you can think about someone who's had a hard time with their mental health, like when they're ready to make that phone call and accept the services, that is the absolute best time for us to be able to really connect with them and help them during that moment of readiness. It can be difficult if we are giving someone an appointment, say 3 months down the road. That might result in them kind of maybe changing their mind or just not feeling ready anymore or whatever kind of happens, or maybe they've kind of escalated and needed something else in the meantime. So we're very aware of the wait time, and we're working really hard to reduce that. And always trying to reduce barriers to treatment, you know, whether it's through stigma, whether it's through location and transportation barriers, being walkable, being connected to other services. So if someone did come to town, say they needed transportation to get there, they could also go to other services, go to a grocery store, go to the food shelf at the same time because they're in a walkable area. And then, you know, really that we want to see people for initial appointments in person because that's kind of the best quality care, but we also offer therapy appointments ongoing through telehealth. And so if transportation's an ongoing barrier and that's something they're going to, the client can request a telehealth appointment. And always we're working on prevention. So reducing wait times, as I mentioned, is a way to prevent an escalation of mental health symptoms. We found one of our models that the short-term weekly therapy can be very effective, actually, that it's not sort of a shortcut, but that it can be really effective in targeting one goal, especially if you have kind of one targeted goal and you're needing to develop coping skills for that. We're finding that the short-term therapy can be very effective for people. And hospitalization, so anyone coming out of hospitalization, say someone's symptoms did escalate, they did need to leave the community, having a place where we can respond. It's known as a statistically dangerous time when people come out of a hospital, so having a place where we can get someone a quick appointment, where they can be seen and come up with a treatment plan immediately, that may prevent a recurrence of symptoms. So at the Access Center, like I said, it's outpatient therapy, similar to what we offer in these two buildings up here, but the two nuances are that we, at the Access Center, have a same-day walk-in appointment and we have a rapid access appointment. And those are sort of our new ideas. So the same-day walk-in appointment, Monday and Friday at 9 a.m. only. So the only time you can walk in without an appointment is at 9 a.m. And we suggest people show up at 8:30 because it is first come, first serve. They do have some paperwork to fill out, like I said, similar to any NCSS appointment. And so that will be a 90-minute initial therapy appointment that they would just come in, and that clinician, we have one clinician assigned each morning at 9 a.m. And we have started this process already, so this is up and running.
So this is running at the downtown location.
Yes, so we opened in December, but I didn't have an open house until May because we really wanted to make sure that we got the kinks out on our own before we made a big announcement. You know, we did allow those appointments and offer them, but we're fully staffed now, which is amazing. And I really probably want to knock on some wood when I say that, but we're fully staffed there, so we rotate clinicians. We have someone each of the 5 days kind of ready and setting aside that time to see someone for a walk-in appointment, which can be really helpful if someone has, you know, the day before said, you know, I'm having this issue, or I really want to talk to someone and I don't really want to wait. And we do find it's a real balance because we still have people who really want that appointment time. They don't necessarily want to gamble on walking in. And so we have that too, obviously. We still have all the options. This is sort of just one new option that we do have for people.
So let me just, you have one spot open on Monday and one spot open on Friday?
No, Monday, Tuesday, Wednesday, Thursday, Friday.
Got
Each day, there's one spot.
Okay.
And really, I mean, it is pretty new, so we've only had just a couple of times where we've had 2 people show up at the same time. Yeah. The second type of appointment that we have at the Access Center is a short-term therapy appointment. And so we have we call them rapid access clinicians. They're outpatient therapists, but what they're offering is we can generally get a person in sooner, more quickly. So say, usually it's within a week, and so that is a scheduled appointment, which is a comfort to some people who really need that scheduled appointment, but that is for 12 weeks of short-term therapy. So that's how we're able to kind of keep people, keep our clinicians able to see more people, but we're finding some great success with that some people don't necessarily want to be in therapy for years and years. Some people really have like that one thing that they want to come in, talk about, and work on. And as we tell people, you can always come back. You can always call and re-engage in services. But it does allow people to get in kind of more quickly and in a really accessible way. And so we say, I do say 12 sessions. It's not really 12 weeks. So they'll get 12 sessions, and usually we're able to offer weekly therapy, which is really nice because that can be hard for some therapists to fit in that weekly appointment. And so the same, when you start with your rapid access therapist, it's also a 90-minute initial therapy appointment, and after that, more like the 50 to 60-minute therapy ongoing weekly. So a few questions I always get: what if 2 people show up for the same day appointment? So Tuesday morning, 2 people show up at 9 a.m. Because they're first come, first serve, it's just simply the first person who arrives will get the appointment. The second person though, because I have 2 access coordinators who are able to do the intake paperwork, they're not clinicians, but they can do some of those intake questions and start the process for people. And so if they are wanting to stay and start the process, they can meet with our access coordinators, begin kind of their screening and their documentation and get some of that out of the way. And they can either return the next morning for the next appointment, or they can schedule with a rapid access clinician for the next soonest appointment. And just anecdotally, what people have been choosing to do is usually to start the paperwork and to take a scheduled appointment with the rapid access clinician, just so that it wouldn't likely happen twice, but that way they're all set up. They know exactly what to expect next. What if a client decides they need additional support after the 12 sessions of short-term therapy? So we do have a process for transitioning someone to our traditional outpatient therapy and longer-term care if that's necessary. So say if this is someone who really will likely maybe need a longer, it wasn't, maybe more things came up than what was presented or what the client even thought at the time, and they really feel like they need more ongoing care, or maybe a connection to psychiatry, and so they would probably be transferred to a longer-term outpatient clinician after those 12 sessions. And this is just some of our data. We have very little data because we're a very new program, but just showing that we really have already, every single month, kind of increased our services and are quite busy there. It's pretty exciting. It's nice to go down there and see that there's a lot happening and that people are using this. And it was sort of just like a project a year or 2 ago that we were working on, and so it's really exciting to me that we are seeing clients there and really offering some help that we didn't have available before. Actually, we have more staff than this now, but this was this amount of staff we had at our open house. We have a few more clinicians now. So we have an administrative assistant there. We have 2 intake, so our intake line, where you call, make your appointments. Katie Mabel is our team leader, so we have a supervisor, licensed supervisor on site every day of the week, which is wonderful. And we have family assessment down there who do assessment with children, and then we have our rapid access clinicians. So I always do remind people at the end that our access center doesn't have immediate crisis services. So really trying to help people just know, and there's no wrong door at NCSS, so if you call us, we'll just redirect you, that's okay. But as much as we can help people understand for clarity, that if someone is in immediate crisis, if they are expressing suicidality or having something much more immediate situation, that is still a situation for our emergency services team. And so you would call and reach out to our crisis team or to 988 for that. But we are really excited to be able to have this continuum of care that we're starting to offer. So emergency services programming, I don't want to speak too much for them since that is not the team I oversee, but I did want to mention 988 and our enhanced mobile services because they are expanding. They're new and expanding and really exciting services that we have. So 988, is everyone familiar with 988? Yeah, so that's, you can either call our NCSS emergency services line and our regular number, press 1, or you can call 988 or text 988. And because of the text, we do find that for adolescents, for people in schools, the text line is pretty popular with a younger population, which is really nice. The other difference with 988 is that you do not need to be in a suicidal crisis to call 988. You can call 988 for any reason, for any type of support. It's a warm line, and if you feel you need support, you can reach out to 988. It's available throughout Vermont, and all the calls are answered based on the schedule between NCSS and the Northeast Kingdom designated agency. And then our enhanced mobile crisis. So this is when a call comes into our emergency services team and there is a situation where they feel like it could be a big help to have crisis team members go out into the community and see the person to sort of help de-escalate the situation. And so it's usually a 2-person response from our NCSS team that goes to a community location. This has been used a lot in schools so far. It has been used out to the home and community, but I would say it's very popular with our schools right now when they're feeling like there's something happening that's maybe above what guidance counselors or administrators are comfortable dealing with. And so it's, again, a preventative response to help with that de-escalation process or with, offering a mental health intervention quickly. So the 988 is, again, a newer service, so kind of just showing that we have really increased our calls the past 3 years since 2022. These are the calls answered by NCSS. And then we always talk about emergency department visits because we want people as much as possible to stay out of the emergency room just because, one, that means that we helped prevent that level of escalation, and 2, because we all know, even though the emergency room does serve a purpose and can help people get a higher level of care and certainly can be extremely helpful, it also isn't the most therapeutic environment. So if there's a more therapeutic environment where we can help people, that would be our first choice. And so we always are tracking emergency department visits and trying to see where can we help people in different creative ways. Any questions on that before I move on? Okay. The Zero Suicide Committee.
So hold on, I'm so sorry. We have a question online, so Matthew's hand is up. Feel free to unmute, Matthew.
Yes, I do. Thank you very much, and thank you for the presentation. How are you going to quantify the data? But I know you got new partnerships with pediatrics. I'm Matt before. I use he him pronouns. I'm from Alfred, Vermont, which is in Grand Isle and Franklin County. It's a funny district, as you may know. Because on the Grand Isle County side, there's a lot of, for current information, Albert is serving about 70% of low-income, high-poverty residents, So like I said, we're in a high-poverty area, like with Isla, so we're not the only ones out here that need these expanded services. My question is how can we quantify the Grand Isle County architect into this, knowing that data is very, very as we know, limited out here in Grand Isle County, knowing that you have to find that to bring a more current, accurate picture of the services that need to be provided. Thank you.
Yes, so because NCSS serves Franklin Grand Isle County, in the slides that I showed, those are combined data. So that would be all of Franklin and Grand Isle, the calls and the response. And we can request, I could request to come back with some data just pulling out only Grand Isle County. I can request that. I don't know. I'm not sure if we could keep that separate. Is that the question? Is it the data that we're looking for?
It ain't just the data, just, what are the response time to as well? We know Grand Isle County residents out here where I live definitely need services. I mean,
Right.
It's just transportation, as everybody knows, in Franklin County, if you go to Grand Isle County, there's very hardly any, and, and some of these families are in a crisis out
Right.
here, so that's the reason why I'm asking that question, not just to, separate data. What are some of those calls? Now, I know it's combined, but just if we were to separate them, which would be the higher need assessment? So we know where we should, so in the future, we will be able to put, the more resources to those counties that actually need it, the most, because like I said, out here is needed. Thank you.
Right, so some of our other teams, not necessarily my teams, but some of our other teams are based out in the community. Like we have school-based services that are in some of the different schools. That's one way that we reach out to. We know also that Enosburg, Richford, area is quite far from our services. The calls that go to 988 are emergency services. So they're responding to, it's reactionary, right? Like they're responding to who's reaching out to them. So it would be a longer response time, but they would come and respond. So it is, we really acknowledge that those are more difficult areas to reach because certainly they're not going to be walking to the access center. So we're always trying to be creative. I know in our community we've had a lot of meetings about transportation and how to outreach to people. I do think that some of that is bringing the programming, bringing the school-based, and that it's not as simple as that, but we are always trying to connect with every community.
We do have another hand raised, so Kate, feel free to unmute.
Hi, yeah, no, just to tag on to what Matthew was saying, it's a really good point, and I feel like is the intention to integrate into those other communities, because the data will naturally show if people have easier access, it's going to show that that area has a higher need. So I'm just curious if there's somewhere that NCSS is actually tracking unmet need so that to prove that need, or if I'm making sense. But I just think about how transportation is always a focus when the workers, like say myself, right? I can transport myself to the community of need. So sometimes looking at what barrier, because I just see this being a definite need in, I would argue, a higher need in those more rural communities than in the center. I mean, we all need more service, but those rural areas are really, really struggling. And I think about the aging populations that can't even if there were transportation, couldn't access the transportation. So it grows, but it's a good start, and I hope to see it out in the rural area.
Right, and so for the data, it's hard to pull data on things that aren't happening. So where we get that information, like I said, is our community needs assessment. And that's where we go and we ask as many questions as we can to as many kind of places as we can. I would say the place that NCSS does a really strong effort in the communities is with the schools. We do have a lot of school-based behavior programs, school-based clinicians. We do trainings in schools. I think for the elderly population, we do have elder care. We have a connection with AgeWell, and we have a clinician who does do home-based care out in the communities. So there are pockets of things we do really well and always open to new ideas also.
We do have data per like the counties and everything like that, just Megan's focused on outpatient.
Just tagging on to that, and I think about working in places like Alberg or North Hero, Isle of Lamont. Can that initial meeting, that 90-minute meeting, be done online? Because what I think about when I, working out in the islands is that even if you have brick and mortar in a town, folks getting to that brick and mortar is as difficult. I mean, that first mile is as difficult as the first, the next 20, so is
yes,
that a possibility?
it can certainly be done online, and that's I will say it's a pull back the other way from COVID, where there was a lot of therapy happening on telehealth, and it was sort of had become automatic, and so we say that our first meeting is done in person because that's best practice, and that is my wish for best practice. But certainly if someone calls and tells my access coordinator that they need this to be on telehealth or they won't be able to access it, that can be accommodated. We've made accommodations before, even for people with extreme social anxiety. That's not a hard and fast rule, and we do use telehealth a lot to combat the transportation barrier with therapy. And honestly, with the elderly population also, because transportation maybe someone no longer drives or just isn't comfortable driving or doesn't want to drive, wants in person in the summer, but telehealth in the winter, and we do accommodate those things.
So we have 2 hands on Zoom. The first one that had popped up was Kate, and then the second one is Isabel, so I'll start with Kate.
Just to the elder care, I have not been able to make a referral and actually get somebody services on that program for years. So I know in the community there tends to be so plug for more of that, because there tends to be a reduction in referral when they know there's a long wait list. It's kind of what happens with our moderate needs program as well. People stop referring because of the wait list. So just a plug for that. And then peer support services. I just read a study or something somewhere, but that online component of having peer support programs maybe too. I don't know if there's been talk about that, but there's definitely in those rural areas having the ability for people to get together if they are waiting for a therapy or having some kind of program like that would be awesome.
So I'll answer the first question first. So we do have an elder care program. The referrals go through Age Well and come into our access coordinator. And we don't actually have a wait time for that right now. So we have openings for elder care.
Really?
Yeah. And
that is not communicated to community. That needs to be, let's talk more, because that's not how it's communicated to community partners. In the aging world services. That's really good to know.
Well, that's my program, so I guess that's my fault. So here I am to say that
it's not.
That program is open, and we are happy to see people. I will say that we struggle sometimes with the referral, with the follow through, because an elderly person who is homebound is essentially the elder care population, and sometimes when they're referred, they will agree to the program, but then become very nervous about inviting someone else into their home, which I completely understand. And so we do find that sometimes there's a referral, it's an appropriate referral, and still the process doesn't go through anyway. So maybe we should increase our communication on that. And the second question, peer support services. Actually, there's a huge push within the state right now to increase peer support services. So again, that's not within my team, but there's not only are peer supports in mental health increasing at NCSS and across all the designated agencies, but they've started a certification program as of July 1. So each designated agency will begin to have increased peer supports, and the peers are going to be supported in receiving more training and certification, which is wonderful.
And what will they be called? Because we have peer support
specialists right now. Yeah, there's going to be, and I'll wait and make an announcement a little bit more thorough at the end about the upcoming 3rd annual mental health summit. So I'll share a little bit about that, but for the quick answer, it's peer support specialist. Yeah.
Okay, and then I have one more question. Do you have services outside of doctor's hours, or 8 to 4? Like, do you have folks that can get appointments at 6 a.m. or 7 p.m.?
We do have appointments. We have nights that we are open until 6 or 7. I believe it's Tuesday, Wednesday, Thursday. We have later hours here in this building and in the Family Center building across the road. And we have some 7 and 8 a.m. appointments. I don't believe we have any 6 a.m. appointments. But as always, those are the most sought after appointments and tend to be the most the most full appointments that we have, right? So a lot of times they'll offer to start and be more flexible and then move into, you know, those appointments as someone has moved on, because they are limited in the number that we can offer.
Okay, super, thank you.
Okay, so
and sorry, you have
yeah.
one more hand. So
One more, okay.
Isabel.
Hi, sorry if this is already kind of an obvious answer, but I'm just wondering about, you know, if someone walks into one of these centers, how like the payment is kind of expected. Is it gone through insurance, or if they don't have insurance, kind of what is expected kind of cost?
Right, so there is a cost. There's, I mean, I would say our primary population that we're outreaching to is the Medicaid population. In adult outpatient therapy, we also take private insurance. If someone doesn't have insurance, we have a hardship application and a sliding fee scale. So there's a number of avenues depending on your insurance.
Thank you.
And we have one more hand. Matthew?
Just a quick tack on. How about, you got Medicaid, but how about I have both Medicaid and Medicare. So how about the other one, you know? I know when people talk about Medicaid or Medicare, there's that other one that we have to talk about. Is there still room to improve on that side of things, you know, to make sure that, you know, we're talking about Medicaid, but how about Medicare? Or vice versa, because like I said, I can use myself as an example. I have both of those insurances, so.
We do accept Medicare, yes, and multiple other insurances. I don't have the list right now.
Awesome. Okay, I think no more hands.
Okay. Thank you for all your questions. It's really helpful to know what people are interested to know. Just a little bit about our Zero Suicide Committee. So we just, when was this, June? Melinda was there. It was this summer, spring and summer. We pulled together a national trainer and a two full day training called the Connect Postvention Program. So a little bit of information on that is when there is a suicide death in the community, often our emergency services are pulled in, and then if there is a need or want by either a school or a family or someone connected, there's a group of us that will go out and do outreach and, you know, maybe do groups or offer counseling or whatever that particular situation the need is. So NCSS has a sort of a long tradition of offering postvention response. In meeting with my statewide Zero Suicide meetings, they are really encouraging us to expand that and include the community and help all aspects of the community be involved in that. So one reason to do that is because we're really acknowledging suicide as a public health issue and not as sort of one little isolated incident. The other is that we help survivors take appropriate action. And that we're really acknowledging that how a suicide is handled can impact the risk for the survivors. So I do put in a plug for suicide as a public health issue. There's 49,000 confirmed suicide deaths each year, and someone attempts suicide every minute in the United States. From each suicide death, the numbers tell us that approximately 135 people are affected, but honestly, I would say it's probably much larger than that. So when someone dies, it's not really just that one person or even their family or their classroom, the impact and the ripple effect is quite large. And in Vermont, we have a higher than national average suicide rate based on our population. And so this is a really relevant issue in our communities. So the Connect program brought together people from all over the community. So not just human services and mental health like NCSS, but also healthcare. We had people from the ER, we had law enforcement, first responders, firemen, faith leaders, all sectors of the community were invited because we're really trying to respond, like I said, not just for individuals and families, which we do, you know, we kind of have a protocol for that already, but how do we expand that to the family, to the whole community, to the society, and acknowledge that ripple effect that has happened. And so this was very powerful. We had 2 full days, and we did have people in the Franklin Grand Isle community from all of these sectors come and join us, which was really incredible to have people take an entire work day. Melinda was there.
It was awesome. 2 days.
Yeah, 2 entire days. Really to focus on how to be helpers and how to join us in a community after a sudden death. Any questions on the Connect program before I move on to our next? So another thing that we are doing at NCSS as part of our Zero Suicide Plan that also came out of a survey that we're always looking for where are our gaps. So one of the surveys, we had even an internal survey that said that people were not, we were surprised by the number of people who were not comfortable talking about and addressing suicide within our own agency, which isn't entirely surprising because we have data, we have admin, we have reception, you know, everyone isn't required to have a comfort level there, but we really have put it in our strategic plan as part of suicide prevention to increase suicide prevention trainings not only in the community, but through our entire NCSS staff. So we're well on our way right now. I think we've trained 240 people, it might be more than that now. So myself and there's about 5 others, we offer You Matter suicide prevention and awareness trainings. And so this is not a clinical training, this is not teaching you how to be a therapist. It's a 3-step training that lasts about an hour and a half, and it really is a lot about reducing mental health stigma, being aware of the mental health continuum, and a 3-step process to kind of show you care, ask questions, and connect people with resources to help. So it's a training about being a bridge for people. Like, you know, I tell people in this training that we are here at NCSS to help you when we know that something is wrong, but it's usually a family member or someone else who's the bridge to help that person say, you know, maybe you should go talk to someone or something seems off with you. And so we're really wanting to train as many community members as possible to make sure that we're all kind of in this together and we're keeping the conversation going. So You Matter, we've actually been offering these trainings at NCSS since 2017. It was a 2012 program established by the Center for Health and Learning, and it's a Vermont program. So there is some data about Vermont. It's very relevant to our communities. But we've really increased lately due to our community health needs assessment and our own internal surveys. This has caused us to kind of take a step back. I think it's hard when you work in mental health because you start to assume that everyone is having these conversations, and we have to be really careful not to assume that and to know that we really do want to be helping people facilitate these conversations. So we have offered You Matter in multiple Maple Run school settings with coaches, with teachers. We have gone to Cold Hollow in Enosburg, and we're continuing. So we already have some more set up this year in Fairfax and Berkshire, and people are reaching out. You know, we tell workplaces or schools, or if you have a group, to reach out if you'd like this training. It's a 90-minute training. It's free, and the Afterglow program helps us fund, and so we're rolling it out as much as possible. said all that. And always mentioning our Afterglow Foundation partnership. Afterglow, they offer the event September 20th, which NCSS loves to help volunteer and be a part of, but they also offer us funds, which are a lot of what we do with that funding is to roll out programming and training, specifically on suicide prevention. And as much as we can, we know that the Afterglow Foundation is very focused on kids and adolescents and schools and how do we get the message out there. And so as much as possible, we are going and using the funds to reach their goal, which is to reach that population. But we are very open to all populations too. September, like I said, is Suicide Awareness Month. We have some of our YouTube show, NCSS Here For You. We've had a couple, there's one on the Access Center. Holly Brennan and I recently had a show focused on a lot of the things I talked about today. If you wanted to review them, some of them are in that show. And this month in September, Dr. Strokoff will have a suicide awareness show that focuses entirely on social media and children specifically. So a lot of information there if you want to reference it. Any more questions? You've had great questions so far, but we stirred up a lot. Amy, go ahead.
I have 2 questions, and I was only kidding about the heckling. These are not heckling questions. These are 2 legitimate questions. So one, when I'm talking to students about nicotine use, or other stuff, mostly nicotine and THC, they talk about anxiety and depression a lot as the reason they're using. What I think they don't understand is that those substances are actually causing stress, anxiety, and depression, or withdrawal. But so I'm wondering, maybe not wondering, I'm happy to help make sure that any clinicians or staff have a really solid foundation and understanding of nicotine and how it relates to that, because the chicken and egg is hard to determine, but students are saying that a lot.
I completely agree with the chicken and egg thing, but I think that's great, and I would love to partner with you and bring you to talk to some of the clinicians about that, because one thing about substances is they constantly change, and so I think people may be thinking of nicotine as cigarettes. There's also people who only are thinking of vaping, so I think it's an important topic to educate on. I'd love to talk to you more about that.
Anytime.
Okay.
My second comment is, we don't have a substance misuse prevention coalition in our region at the moment. So nobody's talking about, in the prevention realm, specifically about alcohol and other substances. So I'm going to ask a question that's not my realm, but we're continually hearing alcohol. I hear from Melinda all the time. It's alcohol that's bringing people in to the ED for substance, and I continue to be a little wary of the alcohol at Afterglow, and I know that NCSS is very involved, and is there a plan to kind of move alcohol out of that because of alcohol's connection to suicide?
That's a great question. I'm not on the Afterglow committee, and also NCSS, when I say we support, like we help set up, we volunteer a table, I don't think it's necessarily our decision or our event. We support in partnership, but I'm happy to bring that issue to the committee. I think that's an important question. You're not the only person who's asked that.
Yeah, that would be amazing. What is it? Infiltrate and influence?
Infiltrate and inject.
And inject. Is how I see my role. So that's what I'm doing, and maybe you can do that as well, because it's really hard to have that not acknowledged as part of suicide prevention.
Yes. Yeah.
Thank you.
And just here's a side from my children who knew, I'm going to cry because, and one of those 135 people went to the first one and left because of the alcohol.
Really?
Yeah. And they haven't been back. And it saddens me because,
I think that's really good feedback, because I'm not sure that feedback necessarily gets back to them, and so I'll be, like I said, I'm not on the committee, but I feel like I can filter that back.
Yeah.
I'm not sure if they're hearing that, so it's an important message.
And another thing to Amy's comment is it's very true, the same with cannabis use.
Yes.
Anxiety, depression, and not being able to sleep, which is
Yeah.
actually causes and becomes this cycle, the same. So.
I was gonna add sleep to that too, because as students, young people are using caffeine and nicotine and THC, they're also using a whole lot of caffeine. And one of the things
Yes.
that I talked to them about, but not extensively, is sleep. And that whole, like, it's nutty what they're doing to their mental health.
Well, and I think it's hard that we try sometimes to separate out substance use and mental health, but we know they're co-occurring for a reason often. And you know, I can say that NCSS is very aware of these issues, and with the Howard Center shifting roles, we are in conversations about how we can hope to fill a gap and be more helpful there. So maybe in next year I'll have a presentation about that.
Well, let me know if I can help.
Yeah, I think I would just highlight that too. I know I've gotten a number of messages, and it's been, anybody who knows me knows that I'm pro-partnership on all levels and all-inclusive. So it's been really hard to find my voice in that area of having an event focused on suicide awareness and prevention with alcohol on site. I mean, I was hospitalized after my suicide event, and the alcohol is what gave me the courage to attempt it. And with the population I work with, that's just, you know, and that's why I want to make sure it's not my opinion or judgment, but just based on facts and statistics, that those two things don't go hand in hand, right? The depressant that alcohol is, with, on top of if somebody's already struggling with mental health. So I know for me it's been a challenge because I'm super supportive of the messaging of Afterglow, and also I've tried to get creative on ways that I can support it financially but not have to attend, because I did attend for the first time last year and I couldn't stay. And also it was more because it was uncomfortable to see people I've helped that were there in the middle of their relapse, and when they saw me, it was a big buzzkill. So it's hard. It's like a conflict. Like, I get it, and not everybody has issues with alcohol, and I applaud people that can enjoy it for why it was created. And then also working in the field of recovery, it is no longer comfortable for me morally or ethically to highlight it to anybody I know who's in recovery, because it feels inappropriate. And yet I'm so pro the event and the people and the heart and the thought that it's like, oh, how do I say this out loud? So I'm happy that other people are bringing it up too, because the event is super important. The awareness is critical. The partnership is critical, and it's such a beautiful event. I would never want to have a hand in harming it. And then also for the care of the people in our community, how can we do it maybe even differently, like have it contained in a smaller area versus spread out and all that good stuff. So I love that those conversations are happening, because in the grand scheme of the messaging, alcohol has no role in that. So it ought to not be taking so much attention from.
Well, and in our suicide prevention trainings, we do identify alcohol and drugs as risk factors. Like you mentioned, you know, they do take away some of that decision making and increase the impulsivity, and so we know that, and we're aware of it. And I just appreciate the way that you're bringing this to the conversation is in a very kind and loving way of maybe how can we help evolve the event to be for everyone. And I think events do evolve over time. You know, no one's asking that it be canceled. Maybe there's a way that it can be more inclusive for everyone. I think that's a great conversation to have.
I love it. I think that's the word, is how can we include those who are passionate about this and unable to attend heavily alcohol present places.
Right.
Thank you so much for how you responded to all that, because I know it's not your thing either, and it's like, oh, I don't want you to get thrown. So I just want to be mindful. So I think I saw that John had a hand up, and then there's also a hand up by Matthew. So we'll go to John and then Matthew.
Okay. I was just curious. You talked several spots about stigma, and stigma is something we face at the food shelf too, and sort of from our standpoint, it's almost like the bad news is that as people are becoming more and more desperate for access to food, the stigma of accessing the food shelf goes down, which is not really the sort of like your afterglows. That's not really the right approach. But I was just wondering, do you feel like you're making progress? The work that you're doing is actually reducing or do you feel like you're making some progress in reducing stigma?
Oh, that's a heavy question.
Not to put you on the spot or anything, but
I mean, I have to believe that because I get up every day and try again, right? So I would say yes, I try most days to believe that. I will say something I really enjoy is like having these bigger conversations out in the community. I really enjoy doing the You Matter trainings because that's where I notice how much, when I'm out in the community with people who don't, like I said, don't talk about mental health all the time, that's where I see, like, this is still something we're battling every day, and we really need to keep working on it. So I think the progress, to be perfectly honest, is much slower than what I would like. I think there is a ton of stigma around mental health. I think why suicide, part of the reason why suicide prevention is such an uphill battle is so uncomfortable to talk about. Very difficult conversations. So I would say both. I think we are making a difference in our community. This community asks hard questions and they push each other, and we do really good work, and I think that's so important, and I've seen a lot of gains in the Franklin Grand Isle community in the past, say, 3 years. I feel like the partnerships have increased. I feel like the collaboration has increased, the open-mindedness. I used to beg schools to let me in to do You Matter trainings, and now we are being asked consistently. So that alone is a really good sign. I also think we have a lot of work to do, I think we have a lot of work to do to get people to have conversations outside of, when I pop in on them.
I also think there's that, for me, my work is, in prevention is very, global. It's for everybody. So how do you change, the knowledge, give skills, and the attitudes and the norms? And when you look at that, that becomes like a 10-year process, right? And where it starts is, Kate said this morning, right? Her little son went and was concerned about somebody else not feeling, and they're little, right? But that kind of change, is coming, and having those conversations. Our children are having conversations, right? For me, I can remember being, heart disease is a silent killer, and even as a kid, when my parents were like, heart disease is a silent killer, I even thought, like, I really kind of feel like suicide might be that, but over time, and we change that over generations. And so as our children grow and they learn about this, and we become more accepting of this chronic issue, right? Like every other chronic disease, it just changes and it becomes part of our life. And it starts young. And so that made my day.
I'm gonna steal a line that Melinda actually said at a meeting, and it's, "I can't, but we can."
Yes.
And for me, like, this is my job, right? Community relations, helping reduce stigma. And, for us, we have this drawing that actually one of our clients made, and it says stigma, striving to increase good mental health awareness. So for me, like, when I'm out there, I coach kids in sports, I'm part of like faith communities, out in the community golfing with elders, and I'm open about my struggles, right? I'm open about being human and vulnerable. And I think that's what I love about Afterglow, is that this family is so vulnerable with the things that they went through. But some things that we've done, and programs that I've seen, BFA has a Hope Happens Here group, which is a peer-led student group, and we've been able to partner with Afterglow and BFA Hope Happens Here. That way these students are able to go out to their classmates and peers and talk to them about resources. The Connect training was all about hope, healing, and resources. And half the time it's that communication error, right, about like what's out there for help. I know we're really focused on meeting people where they're at, like right when they need it. So having programs like the Access Center, 988, Enhanced Mobile Crisis, always trying to listen to the community. Like, being new into the nonprofit world, especially around mental health, I didn't know about all the services that were here. So what I think and what I love about this partnership group, that why we're still here, is to share resources. And I would say too, like, we don't expect people to know everything that's going on with the program, but give us a call, right? Like Megan said, there's no wrong door. And just personally, like, there's been a lot of things this past year with related to deaths by suicide and with children that have been really impactful. And with the You Matter training, not being afraid to have those conversations. I think that's like been the biggest thing. And we have people who are sending us photos about the like the NAMI walk, which is all about
Yeah.
mental health. And so seeing these kids out there with posters, with T-shirts, doing that, I mean, that wasn't something I did as a kid. So, you know, there's those small little wins, and I think it's hard to say, like, on the grander scheme, are we making a difference? But when you see those small little things, I think we are.
And Hope Happens here has fantastic evidence-based outcomes.
Yep.
Okay, Matthew has a
Matt
hand
has
up.
his hand up.
Yes, greetings. Circle back to the new pediatric partnership that NCSS and your guys get involved in. There's a question about that. Is that rollout going to be happening in school districts, or is it going to be in partnership with the knowledge centers across Franklin and Grand Isle County? That's just a question, you know, because I know that has to be in tandem, so I'm wondering if that new pediatric partnership is not just going to be within school districts, but also would that be also include the knowledge center programs across Franklin and Grand Isle County? Thank you.
So I guess I did not explain that very well. The pediatric partnership is a meeting we have at NCSS that we just started. We've had the meeting twice. It happens in this room with pediatricians throughout the county who are concerned about mental health issues that they're seeing in their practices. And so it's a conversation about sort of what are we seeing here in our mental health offices, what are they seeing in the pediatric offices, and how can we help each other and support each other to understand these trends, whether they're substance trends, anxiety and depression trends have come up a lot. That's very present. We have talked a lot about social media trends, and it's really getting that connection back with the PCP offices and NCSS so that there's, again, like that smoother transition, smoother referral process, more understanding of if there's a mental health issue you're seeing in your PCP office that, you know, is there a bigger trend we need to be talking about and understanding together? So that isn't a plan.
Thank you for clarification.
Yeah.
Thank you for clarification. I didn't know if we picked up more about that new discussion about the pediatrics. I didn't know if we heard about that, you know, 2-week discussion. I didn't know about the clarification of what's being involved and how it's going to be rolled out, how it's being more, like you said, discussed. But thank you for that information and clarifying about the whole pediatric being involved on telling us what they see on the ground, on boots on the ground method. Thank you.
Okay, any other questions before we move on? All right, Megan. That was an amazing presentation, like so much information, so beautifully done. Thank you so much, and thank you everyone for the conversation after. So at this point, we'll open up, I'm looking for the clock that's not there, even though I just looked at the time on my computer. So we are up to the point where we can share about any upcoming events, and I know I've got a couple, but I want to give others a chance first before I jump in. So upcoming events, initiatives. Matthew, your hand's up.
Yeah, just to remind you, next, and Michelle Trey, this is an exciting one. As of for next Tuesday, September, next Tuesday, September, whatever, what day it is.
Ninth.
Yeah, the 9th, like I said, the Auburn Family Clubhouse is opening their grand opening from 11 a.m. So if anybody wants to attend, and that's the Auburn Family Clubhouse Child Care Center in Auburn, Vermont, that's actually hosting a grand opening and ribbon cutting ceremony. 11 o'clock, 8 a.m. at the new location site. So in Auburn, it's gonna be an exciting time just to get that event out for that part. And I got one more just for the town. And as for September 14th, Special Olympics Vermont hosting fall winter games for the fall soccer games. Actually, we hosted that Collins Pearly Sport Complex September 14th from 9 a.m. to 4 p.m. So they're already set. They already got the word around and just let you know what's going on throughout the communities between Franklin and Grand Isle County. But that's just all I have on my side. Thank you.
Thank you, Matthew. don't see hands at the moment, so I will jump in. I'm gonna do a share screen. So Stephanie Comstock isn't here today, but she has been sharing about the upcoming open house for the St. Albans Youth Center. So this is for Spectrum. Their open house is on Tuesday, September 9th from 2 to 4. And that's the 135 Lake Street location, the old Red Top restaurant for those of you who are maybe getting more seasoned like myself.
Yeah.
And that's also just, fun fact, the upstairs is the Vermont Foundation of Recovery Certified Recovery Residents. So I'm putting my VTAR board hat on now, which I'm also aging out. I've been on it too long with Peter Mallory. So, but VTAR is certified, the Vermont Foundation of Recovery Residences. They've got, I think, like 8 in the state of Vermont. So that's one of their residences also. But the downstairs is the new Spectrum Youth Shelter, which was a huge win for our community. So if you have a chance to go and say hi, support it. I've been to the space. It's gorgeous. So September 9th. And then I'm also going to do a screen share for the 3rd annual, I want to say this right, Vermont Judiciary Commission on Mental Health in the Courts. It's their 3rd annual summit. So that's coming up on Thursday, September 25th from 8 to 4. The physical location is at the Vermont State House, and then there's also an option to attend it remotely. And I'm kind of embarrassed to say like I'm a speaker, but I actually won't be able to physically be there. And actually that reminds me too, I'm going to switch gears for 1 second. Because I have to go to Northwest Access TV later to record my speech for the summit. And when I think about that, I think about Hunter, who is here, and usually I do a shout out and give you a chance to say something you're grateful for, and I don't want to miss that before we run out of time. So Hunter, as always, thank you for your faithfulness, for coming here, for filming this. Northwest Access is just the best partner. They do so many great things in the community. And do you have something you'd like to share that you're grateful for?
Well, I appreciate your appreciation for starting. Thank you. You are always very kind. I am grateful to be on the mend. I had a couple injuries, and then late last week I started falling a little under the weather. Some nausea, car sickness stuff, and it was just pretty brutal. And today was the first day I woke up, and I was like, oh, I feel kind of normal today. So I'm grateful for that.
Awesome. Thank you for being here so faithfully. So yeah, to close the loop on that, Thursday, September 25th from 8 to 4 is the Vermont Judiciary Commission on Mental Health and the Court Summit. And also there is more discussion around the peers that work in the mental health field and what the, I was on the statewide SIM meeting. So we had a SIM, I shouldn't say meeting, Sequential Intercept Model Action Advisory Committee. So there's a group of us that have met intensely, and we completed meeting, put our recommendations in for this mental health summit event. So that's where those recommendations will be talked about. Judge Zone and Scott Akis will be sharing more in detail what we've been working on over the last few months. So anyway, that's the shout out for that event. Are there any other upcoming events, initiatives? We heard about Afterglow, so definitely put that on your calendars. Yes, Amy.
I want to talk about something I don't usually talk about here, which is Green Mountain Transit.
Mm-hmm.
They, as of the last week, did a little reconfiguration of their Georgia and Milton kind of area. And it means there's a little bit more access from Milton, Georgia up to St. Albans. And so they think of it kind of as a commuter route. I like to pretend that it is a way for people in the southern end of the county to kind of get up here. So if you haven't yet looked into the schedule, don't forget that Green Mountain Transit is here. That route is a commuter route, so it does have a fare, unlike what happens in St. Albans, but there's reduced fare and so on and so forth. So if transportation is something that you hear about, just don't forget to check GMT's schedule.
Thank you.
We talked a lot about prevention today, and I think community and having people around you is a good preventative way for, keeping your mental health in a good place. And our parent-child center is probably one of the most preventative measures that I think that we have for children and for families. So on our Facebook page, if you go to events, you can see a lot of different groups and things that are happening, whether it's us hosting story time events at local libraries, or having stroller walking groups, or there's even Baby and Me yoga, which I didn't think I would like yoga. I didn't go to this baby one, but we do something here internally with our wellness committee And so there's just a lot of really good events out there that, you know, might not be large like Afterglow, but they're all focused around community, and these ones in particular with the Parent-Child Center are about, you know, families, so building those connections and communities for young moms and their kids.
Awesome. We have 2 hands, so I saw the first hand was Megan, and then the second hand is Jess, so Megan, we'll start with you.
Great. I just wanted to share on behalf of Common Good Vermont that there is a town hall, Attorney General Clark's town hall for the nonprofit community on September 10th, where she will be addressing federal executive orders and impacts on the state's nonprofit sector. So that, of course, may be of interest to a lot of folks. Go to the Common Good website to find out, to register for that. And then also a reminder about their nonprofit summit happening November 4th in South Burlington. Should be a big event and lots of interesting learning opportunities for everyone.
Awesome. Feel free to email those to me too, and I can put that in the weekly updates. Wonderful. Thank you, Megan. Jess, so good to see you, by the way. I'm so excited you're here.
Hi, sorry, my network isn't great, so my video's off. But there's an opioids, let's talk about opioids free event in Essex on September 9th at the Essex High School Auditorium. It starts at 5 p.m. There's a barbecue dinner and resource booths, and then from 6 to 8:30, there's gonna be panel discussions and naloxone demonstrations and resource booths, all the good stuff.
I am so grateful for you. I'm on that panel. I kind of forgot to share it. So thank you so much. That will be a big day, a big evening.
We'll see you there.
See you there, Jess. Awesome. Family reunion. Okay, any other updates or announcements? Okay, well, thank you again, Megan, for a beautiful presentation. Thank you, everybody, for attending today. If you do have any updates that you want shared with the FGICpartnerships@gmail.com, we can send them out in our weekly updates. And otherwise, enjoy the beautiful day. Yes.